Issues that matter to us. Experts who can expand our understanding. This is Left, Right, and Center.
Welcome to another episode of a program Left, Right, and Center. Today we have Alberta NDP leader Rachel Notley with us, and we'll be talking about various issues. Those are on political horizon of Alberta these days. So we'll be starting the conversation. Welcome. Pleased to have you here.
Happy to be back, and Happy New Year to you and all your listeners.
Thank you very much. And we saw you were in the Northeast yesterday evening. How was the door knocking?
Well, I always love the chance to get out and talk to folks on the doorsteps. And one of the things that we're doing in advance of the upcoming budget is we'll be having meetings with stakeholders, but we decided as a whole to have our caucus go out to at least 45, if not 50 ridings to just door knock and hear from people randomly what they think about the budget that we saw introduced in the fall, as well as what their priorities are going forward in the spring. And so we're going to use that as a means of gathering people's feedback, and we'll actually be launching a website that sort of outlines a lot of what people have had to say to us. And it was certainly interesting talking to folks last night. I mean, people are concerned about their healthcare. They're concerned about the state of education. They're concerned about security and safety in their communities, and they don't think they're getting what they voted for.
So you have spoken about healthcare. Very recently, the Minister of Health, Tyler Shenro, he released that report of Alberta Health Services, the review report, and he has accepted it also. So what do you want to say about that report?
Well, I mean, I think that this is it's bad news for Albertans, and it certainly reflects a broken promise by Jason Kenney and the UCP to Albertans. You've heard me talk before about the $4.7 billion corporate handout that they are giving to profitable corporations at the same time that we've seen 50,000 jobs disappear from our economy. And so what we're doing is we're not creating jobs, but we are creating fiscal challenges, bigger fiscal challenges for Albertans. And so then these guys are going off and deciding different ways to cut frontline services. In the last election, we were told there wouldn't be cuts, but this report includes a vast array of cuts that are going to undermine the quality of healthcare or any healthcare received by Albertans, whether we're talking about delisting services, whether we're talking about getting rid of over 2,000 nurses, whether we're talking about charging people more for certain services, whether we're talking about opening the door to American-style healthcare. All these things are going to mean that Albertans have much less ability to count on the healthcare that they and their loved ones need being there for them in those difficult times.
You have been talking about cuts, but representatives from the government, they are saying that all that talk about cuts, it's just propaganda. What do you want to say about that?
Well, if you look at the document itself, it's pretty clear what they're talking about. So, for instance, they're suggesting that they can save roughly $600 million by reducing nursing services within Alberta Health Services. I mean, I don't know about you, but when was the last time you went into a hospital or a long-term care center and said, geez, I wish there were fewer nurses here? I mean, that's ridiculous. If that amounts to roughly a 25% cut in the amount of nursing services. And so that will mean a cut. And the other thing to remember is that simply by freezing healthcare, which is effectively what they've done since they've been elected, we're already $1 billion short. We have $1 billion that have been taken out of the system that would have been there had our government been in place. And now they're looking for another 1.9 on top of that. So we're seeing significant decreases in the quality or the very existence of services that Albertans count on.
Your party has been saying that the change which is coming into the drug plan benefits, it would be, affecting around 60,000 Albertans.
That's right.
But government says that the people which are going to be deprived of those benefits, they were not seniors.
What they were is they're members of seniors' households, so they're dependents on seniors. So if, for instance, you've got a two-person household and one person is 68 years old and they've worked for many years and they're retired, and the other person is a dependent and hasn't perhaps worked for most of their life, their retirement was based on the idea that they would both be able to afford their medications. And so this is not anything that Jason Kenney said a word about in the last election. And so these families are now they're typically on limited incomes, and they don't have the flexibility to suddenly start paying out of pocket for their prescriptions, nor do they even, the cost is at minimum $64 a month to families who are primarily on limited incomes. That is a thing that Jason Kenney did not tell people they would have to pay. And when you add that to all the other things that people are talking about having to pay, the list just gets longer and longer. Even in this health services report, we're seeing them talk about raising long-term care fees, raising accommodation fees, increasing the amount of things people will have to pay for in hospitals, on long-term care, more costs for pharmaceuticals inside the hospitals, all those things. It's going to come out of people's pockets, or they're just not going to be able to get the healthcare they need when they need it.
And again, talking about the AHS review report, government is saying that NDP's response is just fear-mongering and hypocrisy.
Yeah.
So what would you like to say?
I would say, of course, they used to suggest that we were doing fear and smear, and I would suggest that what the AHS report is black and white. Mm-hmm. And I would urge people to look at the appendix at the back of that report. It's about a 200-page report, but they very clearly list the things that they want to do to save money. Another area I'm very concerned about is healthcare in rural areas. They claim that they're rejecting the reports to close hospitals. But what they're actually saying is that we're still considering reconfiguration is the word that they're using. What in heaven's name does that mean? This is from a group of people that can't be trusted to keep a promise from day one to day two. When they use the word reconfiguration, what I think that means is that whole swaths of healthcare services that are available in certain rural communities are now at risk. And they talked about something like 77 out of 88 hospitals, but they won't name them. Mm-hmm. And I think what we're going to see is services within those 77 hospitals become severely restrained, and people having to leave their communities to get the healthcare they need.
AISH payment date is going to be changed.
Mm-hmm.
AISH recipients are saying that they haven't been consulted, while government is saying that they did so only to clear some confusion about the payments. What do you want to say?
Well, I think this is one of the most cruel and heartless decisions I have seen out of this government, and that's saying a lot because there are a lot of cruel and heartless decisions. This is solely about playing with the numbers to help these guys make it look like their deficit this year is not as big as it is, because they're pushing payments. It's about, 150, maybe $200 million into the next fiscal year. But the problem is that so many people, these people are on very limited incomes, and they need to, if they don't pay their rent before the first of the month, they end up with fines, like maybe $40, $50, $100 fine. Well, who can afford that when you're only getting $1,600 a month? Same with phone bills, utility bills, bus passes. How do you get to your appointments if you have to walk on the first day of the month in order to get a bus pass because you didn't get paid in time to buy your bus pass before your last one expired? These are simple, practical things that the UCP and Jason Kenney would have known about if they'd bothered to talk to these people before they played this little numbers game in order to pump their own books. And instead, they're focused on playing games with their own books instead of the lives of people that they are affecting.
My penultimate question is that the Federal Court of Appeal, they have decided in favor of that Trans Mountain Pipeline project. Still, yesterday we came to know that maybe the indigenous groups may go for appeal also. What future do you see for this project?
Well, I think the decision that we saw come out earlier this week was actually very good news, and it was a significant step forward. Not surprised to see that the groups that lost are talking about going to the Supreme Court of Canada, but I think that first of all, the fact that the decision is what it is means that the construction can carry on. So that's really good news. I also think that it was a pretty well-reasoned decision, and I think that it's a pretty strong decision. So, we'll see if the Supreme Court of Canada chooses to hear the appeal of the appellants or not. But no question that there was a very thoughtful consideration of all the work that had been done, and it represented a positive piece of news for all Albertans, for all Canadians, and particularly for those folks here in Calgary who are working in the energy industry and are looking for a bit of light in the horizon. This was a good piece.
And ultimately, Alberta legislature session is going to begin around 25th or 26th of this month. What program do you want to give to Albertans before the start of this session?
I think what we're going to be doing mostly is talking to Albertans about what the real life impacts are of the changes that the UCP is making, and pointing out that doesn't need to be that way. We released a shadow budget late last year that showed the path forward without creating all these kinds of hardships. We know that Albertans count on their healthcare and their education, and they voted for a government that would support that, not attack it. So what we're going to do is continue to talk about our plan, and also try to focus more on the need for this government to take economic diversification more seriously, and supporting the kinds of programs that will represent a holistic approach to getting our economy shooting on all cylinders again.
So thank you very much. We hope to see you soon again in our studios.
Okay, thank you. Thanks for having me.
So this was Alberta NDP leader Rachel Notley, and very soon we'll be with you with another episode of Left, Right and Center. Thank you very much.
Red FM.